Good afternoon, ladies and gentlemen. My name is Izawa. I come from the Shinshu University. My name is Atsushi Izawa, and often my name is mistaken. And lots of the times the people from the offices read my name differently, but my name is Atsushi and not Jun, the other way of reading the character. So I am taking part in the World Health Capital Conference, and I try to find a theme that matches the conference. So my theme is health itself, which is very important for you. Protecting health. Is it difficult or not? I don't think so. I think it's easy. So if you eliminate the factors that are hurdles or obstacles to health, it would be easy. So we'd like to start from the backwards to look at the obstacles. So this is the cause of death for the Japanese people, shown in order. So from 1 to 4, I left blanks. But do you know the first top four? First is cancer. So this is for the lungs, the stomach, intestines, everything included. And the second is my specialty field, cardiovascular. And 3, recently this has moved up from 4 to 3, pneumonia. So this is probably due to aging society. And 4 is cerebrovascular, which is one of the themes I want to talk about today. So with these 4, they comprise more than half of the cause of death, probably the majority. So the important thing is, in order to not to have these causes of death, what should we do? I am asked this question quite often. So you may not be able to see this so clearly if you are far away, but if you exclude the non-infectious diseases and look at the diseases, those diseases that have risk factors for death, although it is impossible to prevent death at all, it would if you remove the risk factors, that would improve the possibility of long life further. And as you can see, the Japan Hypertension Society had also released this data. If you look at the top 6, I wonder if you can see from the back, but so I have highlighted it here. This is something that's taken for granted today. From the top, the first is smoking, second is hypertension, 3 is lack of exercise, hyperglycemia, 4, and the rest is salt intake and alcohol intake. So these are considered the risk factors for some of the diseases, and these are the top 6. Please remember them. So this graph is a little bit complicated, but this includes a lot of other information, risk factors that could hinder health. And if you look at the red outline, inside the red outline, there are blue bars, many blue bars. So the blue is this one, cardiovascular disease, which is my special field. So there are many diseases that belong to the cardiovascular division. So out of the causes of death, a majority comes from CV. And if you actually look at the ratio pie chart, it would be the second. 15.8% is cardiovascular or heart disease, and 4 is cerebrovascular. So if you add the two, it's about 25%. This is the cause of death for the Japanese. 25% come from these two. So we want to do something about this. So now with cardiovascular and cerebrovascular, it's not just the death, but after having a stroke, you might have paralysis, be bedridden. And together with aging society, you would maybe require elderly care. And the first cause for that is cerebral and cardiovascular. So in order to prevent nursing, we want to prevent this disease as much as possible. Here, number 2 is dementia, 20.5. This is the cause for care. So with these two, it's more than half. And out of dementia, about 20% comes from cerebrovascular. And so the cause for requiring care, 1/3 comes from cerebral and cardiovascular diseases. So this may be a little out of line from what I was talking about, but coming back to this graph, look at the red outline. And is there anything that you notice? So besides the cardiovascular, these are the risk factors of the diseases on the box, but the biggest risk factor is hypertension. So this is really the main cause or factor for the cardiovascular disease. So with hypertension, why does it link to cerebral cardiovascular? So I would like to explain. So if blood pressure rises, there's always stress on the arteries, and that would lead to arteriosclerosis. And if you have hypertension, what happens to the heart? Depending on the pulse rate, the heart is the cause for the blood pressure, but because of the vascular system, it also affects the blood pressure, because it has to be able to have the same or higher pressure than the heart. And for the heart, hypertension is like muscle training. So if you work on your musculoskeletal system, you would have better, stronger muscles. But the heart is doing muscle training every day. So what happens to a very muscular heart? So the upstream ventricle, left ventricle, here the blood is sent, but if the muscle is too strong, the left ventricle becomes very hardened, and it's very difficult to push blood into this room. So every day, upstream, the heart is pushing blood into the left ventricle, which makes the left atrium larger and larger, which would induce arrhythmia. And if you have arrhythmia or atrial fibrillation in the left atrium, you would have clotting within. If that clot dispatches and comes to or leads to the brain, you would have stroke. That would be a big cause for the stroke. So that's why hypertension is related very much to cerebrovascular diseases. So I talked about a relationship between a blood pressure and stroke. It is not something that is not a factor in your world. According to the Nagano prefecture data, in comparison with the whole nation, so 100 is total of Japan, and left is men, right is women, and the national average is the circle. And as you can see, both men and women, it's two letters are small, so I will read, but there is a stroke and subarachnoid hemorrhage, intracranial hemorrhage. So both cases for male and female, there is a lot of challenges related to cerebrovascular diseases, which has to be solved. And if this can be resolved, this would contribute to prevention of care and also causes of death. And in the societies, we had set up a 5-year plan to work on stroke and vascular diseases. It says CVD here. Cerebral or cardiovascular diseases would be able to be prevented if we work on this initiative. So now we know the state that Japan is in. We are at the World Health Capital Conference, so I did some study. In 2014, WHO had issued a global status report looking at the whole world. This is in English, so I tried to translate into Japanese. So for people under 70 years, cause of death, if you look at the green, infectious diseases, pregnant women, perinatal period, and nutrition disorder, 34%, 14%. The red is trauma and also NCD, non-communicable disease. So this comprises 52%, NCD plus chronic diseases. 52%. So majority or half or more is from this cause. This is the breakdown of the chronic and NCD. In the whole world, and it's also a cardiovascular disease, which is the major cause of death. Out of that, we have 4% diabetes, respiratory disease 8%, cancer 27%, and the rest 23%. So WHO created a global action plan to combat this cause. And I wanted to communicate this to you, so I brought this here. Until 2025, they set 9 targets. First, it comes cardiovascular and chronic diseases, cancer, diabetes, chronic respiratory diseases. They want to decrease 25% of these causes of death, early cause of death, and 10% decrease in intake of alcohol, 10% decrease of lack of exercise, and 30% decrease of salt intake. We did a lot of that, but still they are asking for decrease. In the remaining 30% decrease of smokers under 15. Japan still has challenges for this. Also, 25% decrease of hypertension. Also, stopping increase of obesity and diabetes. So these are the 9 targets of WHO until 2025. So we talked about 6 challenges that Japan had. Do you remember? smoking, hypertension, hyperglycemia, intake of salt and alcohol, lack of exercise. All of these are included in the voluntary global targets. We are in coordination with WHO. So I had very long introduction, but today's theme for myself is teeth, periodontal disease, and in relation to the whole total body health. Unfortunately, these are not included in the WHO targets. Is this a problem or not? No, it is a problem. So this is the main subject I want to talk about. So inflammation of the teeth. If this becomes serious, you would have periodontal disease. It's not a no problem, it's a yes problem. Although it's not included in the WHO target, from various researches, the relationship between periodontal disease and total body health is showing a relationship. So the cause of inflammation comes from bacteria, and with the circulation, it is carried to the whole body. And for pregnant women, this would affect the baby. And here, because you have inflammation, they would promote inflammation in other areas or create inflammation in the other parts of the body, which would affect the total body. And also intestinal flora is said to recently have a lot of impact on the health. And also there's close relationship between diabetes and also lipid abnormality, metabolic diseases. So these have gradually been known or proven from research. So for arteriosclerosis, so it is related inflammation, but there are materials that related to inflammation, and on the surface of the vessel, it would be impacted. There would be some defect to create an aneurysm, or make the blood vessel very narrow. So the gene or the bacteria have been detected from periodontal diseases, which would lead to cardiovascular diseases, and CV diseases related to this are cardiac angina or myocardial infarction and aneurysms. So, does dental health and body health or disease really be related?
I wonder if you know 80-20. Until I joined this project, I hadn't really thought about it that much. That means that at 80, you want to maintain 20 of your own teeth. And before talking about the research results, I want to introduce the causes to lose teeth. There are 3. That is cavities, periodontal disease, and others. And towards the late 40s, periodontal disease becomes 40 to 50% of the reason for losing teeth. So cavity and periodontal disease will be the causes that middle to elderly people lose their teeth. So periodontal disease and the number of teeth should be the focus in connection with the cardiovascular diseases, and the various medical associations and researchers collaborated, and they set up this advanced preventive medicine team, and we did a study. And we look at the gender and age, the remaining teeth, the healthy teeth, the number of teeth lost. And we use CPI, an index, to look at the periodontal disease. And you have a grade from 0 to 4. 3 means that you have 4 to 5 millimeters of periodontal pocket, meaning that above that, from that level, there is a problem. And this is from 2008, April 1st to 2016, March 31st. Of the 6,068 cases of the periodontal disease check, there were 2,574 that were treated with the National Health Insurance, so we can look at the receipts. And so we could look at 19,367 receipts, of which 2,574 would be applicable. There are overlaps. So we did we removed the overlaps and did the analysis, and well, you see 30, 40, 50, 60, 70 every 10 years, and then 2,574, 40.1% are male. And the CPI 3 to 4 indicating the periodontal disease is summarized here. At 40, 45.1%. That is to have a pocket of 4 millimeters or higher. And out of the whole, when you're 60s, 70s, yes, that's numerous, but even at 50s, it's 45%, 60s, it's 60%, and also 70s. So about 60% of people have these pockets which are 4 millimeter or larger. So that is the reality. And now we look at the number of teeth. So remaining teeth. 80-20, I mentioned that 20 should be left at 80 years old, but they are at 70, and the median is 25. So, yes, okay in terms of the number. And we did the analysis of these people. And this is the very important cause and effect, that is the problem with the teeth and the systemic disease. First of all, what was at issue in the first half, cerebral and cardiovascular disease risk. You have, for example, the cerebral infarctions and the cerebral hemorrhages and the cerebral arteriosclerosis, and the doctors will be putting a name to their diagnosis, and some patients will have a mix if you say arteriosclerosis, for example. But the one in red, for example, CPI, for the cerebral infarction, there is a relevancy. Number of healthy teeth, number of remaining teeth, and number of teeth lost. You see quite a lot of red, so that it is related to quite a few diseases. I'm not going to talk about everything, so just let us look at the number of teeth lost and go into detail there. As you can see, as a result of this analysis, we find that every time you lose one tooth, the angina risk will be 6.1% higher, and we use odds ratio here. You see it's 1.061 according to the data. In the same way, for the myocardial infarction, then the risk is 9.6% higher. So angina and MI, as you can see, you have the coronary artery supporting the heart, and if it is blocked, then you get myocardial infarction. Okay, it might be narrowed, and you feel pressure when you are physically in motion. That is with the arteriosclerosis, and if you have an aneurysm, then it's 8.4% higher in terms of the risk. Arteriosclerosis. There are all kinds of arteriosclerosis included here, but it's 5.4% higher. And cerebral infarction, 4.3% higher. And the cerebral arteriosclerosis, 6.2% higher. So this is statistically significant. So every time you lose one tooth, as I said at the first half of the talk, the risk of having a cerebral or cardiovascular disease will be high. And you may think that this is a small number, it's just a few percent. If you lose 5 teeth, then it will be 5-fold. If you lose 10 teeth, then am I 96% higher risk? So now, these were important results. Finally, I only have a few minutes left. What is it that we should do? I want to convey to you something important. So this is last week on November 8th. Do you know what day this is? It is the Good Teeth Day. I didn't do anything myself. It's not too late for you because there's also March 20th. And I think many people don't know about this. I've got the copy here. It's the World Dental Federation World Oral Health Day on March 20th. So the World Dental Federation did a questionnaire survey to 12 countries, and so I want to talk about the results. 56% think it's a good practice to brush your teeth straight after every main meal. What do you think? This isn't the case? Yes, because actually the truth is that you have to wait at least 30 minutes so that there is neutralization orally, because if it's immediately after, there will be an impact on the enamel portion of the teeth. So you have to wait until the neutralization. And how about this? So 68%, they will rinse after brushing right away. So what's wrong with that, you may think? 63% think that what 68% is doing is good practice. And I haven't checked the reason for this, so I hope some dentist will tell me. But it seems that you have to, first of all, spit out the excess toothpaste before you rinse. Next one. This one may be difficult to swallow. In other words, you have to use toothpaste with fluoride, brush teeth at least twice a day for 2 minutes, and that's 56% of the people doing this. And you see worst teeth brushers, Japan. Again, a lot of people, when they have a toothache, finally go to the dentist, and that's 67%. And only 42% tend to seek advice. That seems to be the reality. Excuse me, let's go back. And again, worst offender is Japan. We're on the bad side. So, of 12 countries, knowing Mouth Smart, living Mouth Smart, Japan is worst according to the research results. So, your dental health equals your whole health. That was shown by the results of Matsumoto. In other words, the dental problem is a hidden risk factor for cerebral cardiovascular disease, especially The reason to lose teeth, that is periodontal disease and cavities, you should be very careful of them, especially even when you're not so old. From your 40s, you have to remember that the percentage was very high. So we have the mayor and also the insurance section managers, various universities who helped out and supported this. So I would like to express my gratitude. Thank you very much. Thank you very much, Dr. Izawa. Please give him a warm hand once again.